Just for those who might not have met me before, looking through, I think everyone knows who I am. I'm Katie, I'm from the evaluation team. We feedback process evaluation to Sport England and to you every 6 months. And as we've been working together a lot over the years now, we've tried to change the process so that it's more engaging, it's more about collective sense making and less about me just rabbiting on for a long time at you. So with that in mind, this session is for me to present a very, very brief 5 minutes of some of the emerging process learnings. And then what we're going to do is we're going to hand over to a few local teams, local people who are working in localities on particular issues, and they're going to share some of their stories, share some of their what they've been up to. And I just really encourage you, while we're listening to different people speaking, to adopt a kind of active listening mindset. So think about things like how or why has this happened the way it's happened, or not, as the case may be. Does what the people are saying resonate with what you're seeing in your work, and why do you think that is, or why not, potentially? And then, is there something about this or something about what people are talking about that you might transfer to your own work? So if you can think about those questions, I should have written them in the chat. I haven't got time to now. Maybe Tim can do so for me. Thank you, Tim. If you can think about what it was I said, then that would be great. And then we're going to do 2 stories and then have a breakout session to talk about it, have a break, and then another 2 stories, have a session to talk about it. So I hope that's okay. Oh yeah, Nicole's just said we're going to record the session. It's just to capture those stories as they're being told. If anybody objects, then we can edit out later. I think is probably the easiest way to sort of handle that, or turn your camera off for now. So without further ado, I will share my screen. I'll just highlight those, just the emerging learnings. Nicole, can you just wave at me if you can see that? Is that okay? Fab. Right, so this is, we're still doing some analysis on this, so it's not the sort of final cut, but we just wanted to highlight what we've learned in the last 6 months and how that's changed the way that we understand this work to be developing. And for those of you, just as a reminder for everybody, where we really focus our process learnings is on creating the conditions for physical activity or active lives, being or doing activities. And we've narrowed this down into sort of 5 enablers of change, or you might have heard me call them program theories, but they are involving local people and growing assets, strategic leadership, enabling collective leadership, learning and adapting, effective work across and between sectors, and transforming governance and processes. Now, I'm not going to go into the detail of each of those now. I'm just going to give you a bit of an update from the last 6 months. So forgive me if that is expecting you to remember the detail of that, but I'm hoping that they're starting to become familiar with people now. The first slide I wanted to show you is just really a high level slide from the stakeholder perception survey that we ran back in November, December last year. And what this is highlighting is that there is an indication of a slight development in system maturity, and there has been improvements in scores as to whether these conditions are established across all of the different areas, enabling areas, with the exception of involving local people and growing assets. We're going to come on and talk about that in a lot more detail later, so I won't labour it now. But just another highlight is that generally those in more strategic roles may be more likely to perceive features of maturity than those in operational volunteer roles. So the sense that if you're actually at the coalface of this, you might be less likely to sort of see developments than those who perceive them at a strategic level. But more positively, perhaps those that are regularly in contact with the pilot are more likely to perceive those features of maturity or to see development in these areas. And what we're doing as part of our analysis this time around is making an assessment as to what the local pilot might be contributing to that wider picture of whether the system is conducive to supporting physical activity or not. So that will come in our report. So I just wanted to highlight some of the key changes or some of the key developments here around those 5 different enablers of change. So involving local people and growing assets. By and large, we're just seeing quite a lot of challenges in this area, and largely that's attributable to COVID. But clearly we all understand that people haven't gone anywhere. They're just more difficult to access because of not being able to meet face to face. Having said that, through the GM strategy work, there has been some really engaging online events, and so it's just about how do we connect that up and with the local pilot, and also how do we celebrate some of the work that is being done in the local pilot to involve local people. And then just a little reflection here that across many of the localities there are community investment funds, but the extent to which these are really reaching new people is questioned quite largely across the system. So trying to connect in that work to widen the reach, and deepen the reach, and also bring that into some of the local investment opportunities that you have. And we want to really discuss that today. The second area around building or strategic leadership, enabling collective leadership. So again, this is something which is ongoing, but what has really come to the fore is people feeling like they might have more confidence and skills now to lead locally, but actually in their place of work, whether or not there are actually structures or plans for place-based working where they can really sort of bring those new skills to bear. So that's again something we want to sort of pick up today, and we'll explore in future weeks. In terms of effective crossing between sector work, sorry for the animation here. Again, it's still important, and what we're seeing emerging is further areas to work across locality and sort of in some of these thematic areas. And just shortly, we're going to have Emma and Steve talking about some of the work they're doing around work and health. And later we'll have Stephen and Ben talking about how potentially doing this work across localities allows you to amplify particular issues, perhaps around inequalities. And then last couple, so transforming governance and processes. Apologies, I haven't taken my animation off, which I meant to do. So it's really here is about that there hasn't been that much development around transforming governance and processes. I think people have really just been recovering from COVID and trying to get things up and running again, or a lot of things are on hold still. But we just wanted to press home some of the learnings from COVID and the ways in which the place-based working has adapted because of COVID, how that can be translated into this work. And then the final one around learning and adapting. Again, and I apologise for my previous presentations around learning and adapting, where my voiceover presentation might have indicated that this hasn't been a focus for GM Moving local pilot, and that's not the case. It's been a focus from the very start around creating the conditions to learn. And what we've seen in the last 6 months is actually people have really built their critical reflection skills, and their ability to question themselves and each other has really developed. And so we want to really celebrate that as well. So that's an absolute whistle-stop tour through some of the key learnings, but hopefully that lots of this will come through in the next few minutes with our discussions. So I'm going to stop share now, and I'm going to invite Lizzie to come forward and unmute, as well as Emma and Steve, if that's okay. And we're going to just start to have some discussions about what's been going on in place. So Lizzie, over to you.
Hi, yes, hi everyone. Yeah, again, I think everyone knows me, but just as a reminder, yeah, I'm Lizzie from Sheffield Hallam University as part of the evaluation team in Oldham, Rochdale, Tametide and Glossop. But yeah, so yeah, I thought it'd be good if we could have a kind of conversation with Steve and Emma. So Steve is based in Oldham, working on the kind of work and health area of work and the worklessness kind of agenda, just 1 day a week, and Emma is in Rochdale. So yeah, if you could start off just telling us a bit about how you're planning to build physical activity into the area of work and health, how you've kind of gone about it. Go on, Emma, do you want to start?
Yeah, will do. So my role is for, well, it's work and health officer. So I sit in the work and skills team at Rochdale Council, but my role also links in with public health. So what we have decided to do is to work with the different work programmes. So work and health programmes, special employment support, the adult education budget, so the trainers, and eventually moving through to Job Centre Plus, to encourage system change within those programmes to enable key workers to have conversations and to encourage physical activity with their customers. So we're using the key workers and the job coaches to promote and encourage physical activity via the contacts that they have through the different programmes. And it's kind of a bit of a step change programme, so starting off small and then building to bigger things. That's very quickly what Rochdale have decided to do. So I'll let Steve talk from Oldham's perspective.
Yeah, so I'm Stephen Neal from Oldham Sport Development as part of the council, but pretty similar in terms of what we're doing as Emma. I'm only focused on it for one day, but then similar outcomes in terms of we've looked at around the key workers and how that obviously can influence that whole system change. But then looking at this sort of workforce as well, knowing that if they don't know about it themselves, likely it is they're not going to be able to have those conversations through lack of experience themselves. So it's a case of we're just trying to build on those sort of 3 steps around the sort of key workers, the workforce themselves, and then obviously linking to that system change and sort of looking at even to the points where things like the paperwork's been there for that many years, but still saying things like exercise rather than physical activity, and it's just changing that mindset as well.
Great, thank you. So what is it? Where's the kind of physical activity aspect of it come from? Where's the kind of authentic interest on that common purpose in physical activity? Where's that crossover come from?
Do you mean between the 2 localities?
I think first of all, Emma, just in terms of how or why is physical activity, or how could it be important to the area of work and health, and then we'll talk about localities.
So the work and health programmes, obviously, as is indicated in the title, are meant to focus on health. So therefore, talking to customers about physical activity is part and parcel of what the programmes are about. What I think Steve will agree with is what we've found when talking to key workers is actually the focus for those programmes is to get people into work. The focus around health seems to have dropped off and those conversations aren't enabled. So the contracts are quite restrictive for people, and they've got to work to quite strict targets in terms of the numbers of people that they get back into work. So it's not giving key workers, job coaches, trainers the opportunity to have those conversations around health and around physical activity and how that can support people into meaningful long-term quality employment. And that's kind of where the interest has come from us, because those programmes are meant to talk to people about being physically active, and most of the time we're finding that they're not able to do that.
Yeah, I think that's quite what we found in most of the conversations is that actually we all know how important it is to get to employment, actually getting the physical activity, but then the well-being comes off the back of that, getting the routines in place for people and the motivation to get out and do a little bit more. And that's where those incremental steps, if we can get them in some way, shape or form involved in actually getting out the house, which we know a lot of people aren't doing in those sort of areas at the minute, it's trying to change that mindset. And if it becomes actually people are walking to eat, or even going, like we've said on some of the other calls, into the back garden instead of just staying in the house all day, just to change that sort of scenery and actually try and change that mindset of going outside and doing a little bit more and changing that exercise sort of branding to them being actually going walking your dog counts, going to the park with your family counts, and it's changing that mindset that then obviously hopefully in the long term will get them towards employment. We know it's probably a long step to get people to that employment stage, and everyone's going to be on different parts of that spectrum. It's how we can get everyone to the point where they are ready for employment, but knowing that some people it's going to take a lot longer than others to get them to that point.
Brilliant. Okay. And so so obviously I'm evaluation lead for Oldham Rochdale, so I've kind of seen this all form. But so where did it come about? How, I guess, why are you working kind of across localities, and what are the benefits you're seeing from that kind of joint approach?
Both localities wanted to look at the work and health programmes, so it made sense for us to look at that together, particularly because we've got similar aspirations in terms of what we want to try and achieve. The demographics for both boroughs are very similar. The health inequalities and the challenges are very similar. Oldham and Rochdale like to have a fight between 9th and 10th place over everything that we're worst at. So it's just kind of, it makes common sense for us to do it together. Steve was going to be looking at the work and health programmes, as was I. We both had similar ideas around setting up forums with the key workers. So for us, it made sense to bring that together, and it enables us to compare and contrast the information that we're getting from work programmes that are doing the same thing, but in 2 different localities.
I think the good thing as well is just being able to actually bounce off each other as well, because sometimes you'll end up, especially like we've not come from that sort of background, and it's quite good to have them different set of eyes that are looking on the sort of employment. We've obviously got members from them teams that are really helping us out, but at the same time, sometimes we're looking at it with that different set of eyes, and we might see it completely different to the sort of employment and skills managers that are already in place. It's then for us to bounce ideas across, and I think that's really helped, because like we're saying with the comparisons, some things might work in Oldham but not in Rochdale, and actually it gives us that opportunity, as it's obviously that pilot, for we might trial something, see if it works in Oldham. If it does, we can then share that with Rochdale and say this is something. If it doesn't work for Oldham, we could say it might not work, but if you change this, this and this, it could work. So it's obviously just improving that resource that we've got and how we can use it a little bit better, I think.
We kind of try and complement each other, I suppose, as well, because both Steve and I come from totally different backgrounds. So we're able to look at things with different hats on, and Steve's able to give me ideas, and I suppose maybe he might disagree with me though. I might be able to give him some ideas around things as well. But I think because we've got differing backgrounds, we kind of complement each other and help each other along with the programme as well.
Yeah. Definitely, Brill. Yeah, and you've both definitely helped me try and understand that kind of area of work as well, because it's a complex one, isn't it?
Yeah, we've all been learning together.
Yes. Brilliant. And yeah, just finally, any challenges?
Yeah. Do you want to go first on this one, Steve?
I'd say probably one of the biggest challenges is actually trying to understand the whole work and health sort of framework and who sits where and who's the right people to get to. And I think we're getting to that point now where we're understanding who the right people are to speak to or to get involved in these conversations, or actually how it's going to work best. So we know moving forward now it's probably easier, not everything to be done through these forums, but actually sometimes attend these morning meetings that they're doing, because we know we're going to catch more key workers to have those conversations. We're probably finding, and this is probably not just in the work and health sort of life, it's the signposting and understanding what's on offer across the borough is probably the hardest thing. So it's understanding how we can make it easier for anybody to just be able to find what's on offer local to them as soon as possible, knowing that then it's going to help them get into physical activity, because we know if somebody can't find it quite quick, they'll probably just switch off from it and think, actually, I'll do something else instead. So it's how quick we can get them interested and involved in something physically active. And then obviously how we can help signpost is probably quite hard, because some of the systems that are in place are quite new, but there's not a lot on there. So it's making sure everything's on there so that the key workers can find the right information and share it as soon as possible, really.
Yeah, I would agree with that. The signposting for us is key, and I think what we're finding is the way that key workers have historically done it is ineffective, because they haven't got the full suite of information at their fingertips. And if they were to go and find what might, you know, encourage somebody to be more physically active, it might take them a full day, and obviously their job roles don't allow for them to do that. And I think key workers themselves are facing huge challenges in terms of the targets that they're required to work to. And I think that's one of the biggest challenges for us to try and overcome with them, around how they can have those conversations when their job roles don't really allow them to do it as it stands at the moment. I think that's the main ones we could probably go on for a lot longer, but I'm conscious of time.
Yeah, Emma and Steve, thank you so much. That's really good. Thank you, Lizzie, as well, for introducing the questions. And just as you were talking, I was thinking about the crossover between that and potentially social prescribing and green prescribing too. So do think about that in the breakouts when we get there. So I'd just like to invite now Kath and Stephen and Ben and Gabbi to just again come forward. And we're really interested to hear about your work. I know we know a lot about your work with inequalities, but just some of the work you've been doing kind of together as well. So Kath, are you all right to ask some questions?
Yeah, sure. Hi, can you hear me? Yeah. So we've also got Tom on the call as well. So yeah, so we're talking about the effective work across and between sectors, but specifically thinking about how to support disabled people lead more active lives, and the work that Ben has been leading on in the Empower You project and the wider piece. So we've got Stephen from Seashell Trust, with obviously the focus of supporting SEND and disabled people be more physically active across the Stockport pilot, and also Tom and his work in Trafford. And we're also thinking about this from the GM-wide perspective as well. So there's a few things going on here, but I'll hand over to Ben first and just ask him to just tell us a bit more about the work he's been doing to try and embed the accessibility of being more physically active, providing opportunities to disabled people, and how that's worked across both the local pilots and the GM-wide piece.
Yeah, so broadly, sort of the approach we've taken I predominantly work in Salford and Trafford in relation to the local pilot, and there's a bit going on at GM level, but it's basically trying to step away from specialist provision for disabled people and increase capacity within the mainstream physical activity offer. So disabled people are able to access things in the mainstream to support integration and inclusion. So in Trafford, that's looked like, in relation to local pilots, look like Empower You, which is a programme of work, which all my work seems to fall under now. So everything that I do is sort of associated with Empower You. But Empower You is actually an approach which works with disabled people on the ground to find out what physical activity they like to do. And then we go out and source those activities locally, make adjustments to them. So that involves staff training, or sometimes making some physical adjustments, so getting raised beds in for wheelchair use if it's gardening, adapting gym programs to make them easy read if it's people with learning disabilities who want to access the gym. And once we've put those adjustments in place, we'll support the group or individual who've expressed an interest in that activity to access it. Support the group for about an 8-week period to build up confidence from both the people accessing it and the providers of the activity in providing to disabled people, and just establish a bit of a routine of engagement. And after the 8 weeks, we take a step back and we just keep replicating that within a community until it basically makes the need for specialist services such as Empower You unnecessary, because there's more capacity in the mainstream. And in Salford, a similar approach, but less work on the ground supporting disabled people into physical activity and more looking at the systems and processes and current methods that mainstream organisations use to provide physical activity more broadly. So some examples are working with Salford Community Leisure to provide guidance on inclusive play, so that they can, when they're delivering PE sessions in schools, they can engage disabled children more effectively. Working with disabled children to design what accessible parks and green spaces might look like, to inform the design guidance for parks and green space teams. And more recently, some work's come up with Salford CVS to support some of their award winners through the Boost activity grants, which is also local pilot funded, around how the award winners can offer more accessible activity. And I think what the local pilot's done in relation to obviously join it all together is provided a bit of a vehicle really to join up the conversation across localities. So making me aware of some of the work Stephen's doing, and that's just helped to amplify the voice around reducing inequalities for disabled peoples, which has led to a more sort of strategic group really being developed at Greater Manchester to see how we can embed this best practice as a borough, rather than it just being in the odd locality where there's a person sort of leading in that area. So
great, thanks for that, Ben. And I think at this point it'd be really interesting to hear from both Tom and Stephen, you know, how they've taken that, the knowledge that you have, and you know, embedded that at a local level, and then tried to make sure that you know, it's almost like Stephen talks about the piece about accessibility by design, and you know, the less need for the specialist approach, and how we can mainstream accessibility. So maybe Stephen, do you want to start and just explain how that's worked in Stockport?
Yeah, absolutely. Yeah, totally endorse what Ben says. This is about listening to the voice of lived experience from communities, and they want equality of access and opportunity to things in their local area to be active. And so within the work of the local pilot, we're kind of following three themes within that. One is around workforce development, and that's simply looking at the people who may be around a disabled child, person or adult, to enable them to have access to services, programs, environments, etc. So the training programs we've delivered is the Active Families program. We're just about to work with the workforce around PAs and support workers. It's a legislative requirement of the EHCP process that built into the health and social care plan. For some people, they receive a personal budget or a support worker to assist with respite and to achieve their health outcomes. Now, that workforce is huge, and we want to train people to provide active support in their care, not just to provide that baseline care and health and social care, but also to provide access to activity and be the activity activator. So that's one theme. We very much look at organisational development, very much like what Ben said. So, you know, we test and learn things in organisations that the kind of outcome is that it increases the participation and involvement of disabled people within that mainstream environment. And, you know, we've got a number of different products that we're using already through the Activity Alliance. There's a Welcome Me app that we're looking at the moment, and other programs that we know are what we perceive to be best practice to involve and include disabled people within a mainstream environment. That takes a number of different conversations with providers. I think the best approach is, you know, to have those system leadership conversations, which is looking at the needs of the local area from the disproportionate inequalities, but also listening to how people can come on board with that agenda, but let them lead the conversation. Nobody likes to hear what they're doing bad, but we all want to lead towards improving the local area collectively, hopefully within a shared vision, but also within the sort of strategy and a commission arrangement. So we've done a lot of work around that locally in Stockport to start to have some of those conversations around organisational development. The last thing is around systemic errors for disabled people. So there are systemic errors for disabled people to access swimming and the system for swimming, and also cycling and walking. And what we do there is a co-productive, co-design approach with disabled people to go swimming, to go cycling, and to go walking, to tell us their experiences. And we sort of investigate elements of the system that isn't working, that prevents them to access those key parts of the physical activity. So that's generally it in a nutshell.
Great, thanks Stephen. And we'll just hear from Tom, who's just going to explain a little bit about the work that he's been doing in localities and really the benefits of working in this way.
I suppose building on the work that sort of Ben's been leading and through Empower You in Trafford, what that's demonstrated to us quite clearly is that there is a demand for those with disabilities to engage in a much broader range of physical activity than we were probably aware of, and that might be some of our own bias about choice and enablement around what people can do. And I think what we've now got is a body of work and best practice that we can begin to embed into our strategy refresh, so we can have a much more positive and, I suppose, connective conversation with our partners about how they can enable themselves to create sustainable opportunities. And I think from my perspective, you know, if they're mainstream, they are more likely to be sustainable for us. And I think it's almost flipped the conversation on its head for us locally in terms of how we consider the provision that we build into our strategy, but then also the questions we're asking of our partners and colleagues and those working in our localities.
Yeah, great, thanks for that, Tom. I'm just conscious of time, but I do have one final point, which is around you know, Stephen spoke about the systems leadership piece and those conversations. You just spoke about the strategy refresh and ensuring that, you know, this conversation is heard there. Ben, can you just tell us a little bit about, you know, how the conversation is working, you know, across sectors, but also at a higher level in terms of you being able to really promote the accessibility and opportunity that's needed for disabled and SEND communities to be physically active?
Yeah, I think it's got good buy-in at sort of a leadership level. So Hayley Leave has been quite involved in it, which has been good. That's brought the likes of GM Active on board. So there's different voices in the room than you might traditionally associate with sort of disabled people conversations. So I think from our sort of learning there's the appetite there for change. I think there's been sort of some concerns about resource associated with making mainstream opportunities more accessible. So it's about flipping it on its head and seeing disabled people as an opportunity for the sector. It's a largely untapped market. They've got Purple Pound is a massive amount of money that we can tap into as a sector, which is always good for Ledger Trust and providers. It's an opportunity for new footfall and new income. And also there's an appetite for change, but there's a bit of uncertainty around what best practice is. So there's lots of pockets of best practice going on. So we're trying to join those dots at a Greater Manchester level so that we've got something to move forward with as part of GM Moving to say, this is best practice that we can all commit to and apply within our localities. So it's just trying to join those conversations up so we've all got something to aspire towards and implement.
That's great. Thank you.
Thanks, Kath. Thanks everyone. That's really interesting and sort of inspiring. I'm really interested in continuing that conversation now into breakouts and really thinking about how do you find that common interest and how do you work effectively across sectors, working together to perhaps amplify what each other are doing as well as learning from each other. So if I can just ask Nick, we'll go into breakouts